I'm by the names of Samson Minari, a senior medical clinic officer at Kisoro Hospital, at the same time director for Village Health Worker Project. Allow me to talk about Kisoro District Hospital and Doctors for Global Health Collaboration. First and foremost, Kisoro District Hospital in the extreme southwestern corner of Uganda, one of the remotest districts. So the collaboration has lasted 15 years. The collaboration came in at a time when we really needed support by doctors in Kisoro Hospital. At that time, the doctor-patient ratio was 1 doctor to 40,000 patients. So way back 2006, doctors started coming to Kisoro under Doctors for Global Health, headed by Professor Jerry. They started teaming up with a very few doctors that we had in Kisoro Hospital, not more than 2. They started caring for the patients. Later on, residents came in. They started caring for the patients. Eventually, long-term students also joined. During the process of caring for the patients, there came an idea of having a project in the community. You know, Uganda has a health care service system whereby you have a health center 2, health center 3, a health center 4, a district hospital, a regional referral hospital, a national referral hospital. And now we realize a health center 2 needs a health center 1, whereby there is no structure at that very level. So during our discussion, we realized that there was a need of having a human resource at a health center at a village level, which would represent a health center 1. And who are those? We thought of having village health workers who would have a package at that particular level, care for the patients, link with the center 2, 3, and so forth. So there came a need to have a village health worker project, and that village health worker project started in Muramba as a sub-county, which is one of the 14 sub-counties in Kisoro district. So that village health worker project has given birth to very many other projects as a result of long-term students' involvement in studies. For example, during the early times, there were no patients with chronic diseases. If they were there, they were very, very few, till such a time when the residents, headed by Professor Jerry, asked us why there were no patients with chronic diseases. So it caused us to institute a mechanism of carrying out a study in the community to identify whether there were some patients, some people with chronic diseases. So the long-term students came in. Those long-term students carried out studies in some villages, and eventually we realized that there were people with chronic diseases quietly in the community, and some of them would end up with complications which we at our local level would not have detected. So I can say that was a great achievement. That study that gave birth to a clinic with patients with chronic diseases. As I talk now, the clinic has 1,330 active patients. That is by December 2019. So this was as a result of that. And this continued slowly, and with this number, it caused us to think of having another aspect of caring for the people with chronic diseases by decongesting this clinic so as to have a few number at the hospital so that village health workers can continue screening and allowing room for this patient to be cared at community level. And that one, we have a clinic in communities where some of our trained clinical supervisors go and attend to these patients. right from there. So we can say this chronic care clinic and the management of patients with chronic disease in the community is a great achievement. But before that, I can say formation of vibrant village health worker project is one of our greatest achievements, whereby we have had long-term students being involved, short-term students being involved. I can recall at early days when we were starting the village health worker project, Dr. Gloria, who at this level is now a GHAC, was fully involved in the early days in the starting of this village health worker project. So these village health workers have been trained. We have 52 in number who are active, but they have been trained in 4 courses, and they have been equipped with the knowledge and skills in many other aspects. One, these patients that we have had in chronic care clinic, village health workers have been involved in screening the adults in the community by taking their blood pressures, by taking history to see whether they could be having asthma, by taking history to see whether they could be having epilepsy, by taking history to see whether they could be having diabetes, and some of those categories would be referred for confirmation at the hospital. So those who will be confirmed to have these chronic diseases would be enrolled under chronic care clinic. So that is one of the greatest achievements. And another greatest achievement is that throughout the life of this village health worker project, we have seen some other interventions coming up, like caring for the malnourished children who would have died, but because of the involvement of village health workers screening the under 5s and identifying those who are malnourished and enrolling them for food supplements and educating the mothers how to feed the children, that has contributed a lot. Many children would have died if there was no this collaboration. This collaboration has gone further. As I talk now, we would have lost some children if this collaboration was not there. We have had 22 children who were identified with cardiac conditions and ended up being operated outside Kisoro. And these ones wouldn't have known them at our local level, because our capacity to diagnose people with chronic diseases, more especially those with cardiac conditions, our capacity is limited. But the collaboration by having the Professor Jerry's, the residents, this one was a great achievement because they were able to identify 22 who were referred for surgery. And as I talk now, 18 of them are living and they are now adults. Because this one, it started in 2015. Some of them are adults, others are children under this arrangement. Many other projects came up. For example, during the implementation of village health worker projects, some other long-term students carried out a study and identified a gap in health service delivery, especially under women category. We realized that that package was not being addressed, especially screening of cervical cancer of cervix. So the long-term students, I can recall Reno and Harvey, who participated in this and were able to get a team from US that trained our local team how to do a simple method of screening women with cervical cancer. And those who were identified, intervention were laid locally, some were referred to Murago, and these women, to my own understanding, wouldn't be living up to today if this collaboration was not there. We have had patients on the ward with severe conditions who really benefited from the advanced care from the residents and the GHACs. That was a great achievement in as far as hospital setup is concerned. These long-term students who have kept on coming have enabled us to teach or equip village health workers with knowledge and skills, because I realize they participated in development of the curriculum for training these village health workers by looking at the national curriculum and international curriculum and condensing the two and coming up with a special curriculum that has equipped these village health workers with advanced knowledge and skills. For example, this village health worker project is so unique compared to other projects, not only in Uganda but Africa. It is a unique project in the sense that these village health workers have been trained and they have packages that they deliver to the communities that contribute a lot to the well-being of the communities. For example, they were equipped with the knowledge and skills on how to identify people with the acute illnesses and manage them at that level. Those that they cannot manage, refer to the appropriate level of health service delivery. They have been equipped with the knowledge and skills on how to keep on screening the adults and see those who could be having chronic diseases. They have those skills. They have been equipped with the skills of how to screen children who could be having malnutrition and consequently intervention. So they have really been equipped with a lot, in a sense that long-term student involvement has enabled us to achieve this. The constant coming of GHACs, the residents and the students has also improved on quality care of our patients at Kisoro Hospital. There is no doubt Kisoro Hospital is at a level compared to other hospitals, and when they were grading the hospitals in Uganda, in southwestern Uganda, Kisoro was ranked #1.